Namaste, everyone.
Namaste.
Yes, oh, Dr. Tom.
Dr.
Yes.
Kamal. Namaste.
Namaste, namaste. Yeah. So after a long time,
Kamal. Good to meet you.
oh, yeah, hello. I'm still living in the hangover of the education week. I'm still living in the hangover. Maybe most of you will understand. The hangover has not gone still. I don't know when it will go.
Wow.
Yeah. Still missing everything. And the whole education week was the best experience.
Yes.
Yeah. Oh, Devra.
Hi.
Hi, hi. I asked Ilke other day, give me some tips so that, I can overcome this hangover. I am not able to overcome the hangover of the education week. Still, it's going on. Yeah. Am I audible? I think
Yes.
that,
Yes, you're audible.
Yeah. Hi, Ilke.
Hi, I miss you.
Yeah, I missed you too. I missed everyone. Yes, Radu. Yeah,
Singing
Nusrat.
Slotas
We
is
all
alone is very
miss you,
boring.
Dr. Kumar.
Yeah. I missed everyone, Sharmini ji. Yes. Everyone. This education week has been the next level, I think. So wonderful and so amazing. There were so many things happening. It was magical. Yes. Andrea, Catherine. Yes. Hello.
I can't wait to join you next year.
Yeah, I was going to say that really, even however we try to put it in words, how the experience was, no words can do justice to that experience that we have experienced. I think right now onwards only start, preparing that everyone should be there for the next year because it's like
Yeah,
amazing.
definitely. I will miss it. Thank you. We miss you anyway.
Okay. So we will start with today's session. Dr. Hemang will join us at the end. He's busy with the clients as he's in Europe. So we will start. Okay. Yeah. So Vinay Bhai, are you ready to share the slides? Yes. So before that, we'll do the prayer as usual, as our tradition. Maybe some of you would like to say the shloka maybe that we have done. Anyone willingly? The shlokas that we have done, would you like to recite? Or should I do the prayer? Anyhow.
Okay.
If you have the paper handy, you can. Yes. Yeah, let's start. Everyone, whoever is having it. Okay. So when I say start, then we will start. Okay, together, everyone. Then we'll say start. The 5 shlokas that we have done. So 1, 2, 3, start.
Ayukamaya manana dharmata sukhasadanam ayurvedu vadeshu vidye paramadara hitam sukham dukam ayurasya udam manasya yakshotam ayurveda uchyate samadosha samadhatsu malakriya prasana atpajnana swasya avidyate Vayuvidam kapacheti prayosha sadha vikruta deham Nandike Pratita
Tatra
Prarupta
Maharashtra
Hikam
Sasnahatishanam
Lagunam Lahu Vishnu Pavanam Sarvam Mumanda
Ram Rushnastra.
Wow.
Yay.
That was big.
Very nice, very nice, very nice. So yes, this is amazing what was done in this education week. This shlokas and everything. So we have recited that, and we will seek blessings of the great masters, Lord Dhanvantari, the Siddha Veda lineage, Vaidya Jivaka, Baba Ramdas ji, Pankaj sir, Smita madam, my guru, Sadguru Vena Bharti Maharaj. And with that, we start our today's session. So we are going to learn today about some herbs as we are continuing with the herbal supplements and herbs part. So we are going to learn today about the herbs Gugul, that is Commiphora mucul, then Arjuna, Terminalia arjuna. Most of these plants we have seen in the forest as well. Draksha, which is Vitis vinifera, Jahar Mohara pishti, which is the serpentine, Amlavetus, which is the Garcinia pedunculata, Pushkar moon, which is the Inula racemosa, then Tagar, which is the Valeriana valichi, and the herbal supplements like Fibron, which is the Granthihara tablet, Hartone, which is the Jivan Rakshak tablet, Metaboost, which is the Suruday tablet, and Rakta Shanti tablet. So again, one of the major, we can say, herbs and herbal supplements we are going to study today. And today the herbs and herbal remedies are there for the heart-related health challenges. So we know that the heart is the important organ, one of the vital, we can say, marma points also. It is regarded as one of the main marma points, or the one of the main vital points of the body, which, when by any chance gets injured or something, the person can lose the life instantly, which is the Sadhya Pranhara Marma. So any disorder which is related to the heart requires an quick intervention in the form of treatments and everything. And today we are going to see some of the herbs and herbal supplements which will help as an intervention in these different kinds of heart disorders. So first herb is Gugulu. Again in the picture we can see the Latin name is Commiphora mucul. Earlier also we have been studying about this herbs. English name is Indian Bdellium. So Commiphora mucul, Gugulu. Next slide, please. If we look at the Rasa Virya Vipak, again, I'll just revise what is Rasa Virya Vipak. I think everybody knows, but still, the Rasa is the taste, the 6 tastes, which, we pursue by the tongue. As soon as something is put on the tongue, the first thing that we pursue by the tongue, the sensory organ, that is called as rasa. The rasas are of 6 types, which is sweet, sour, salty, bitter, astringent, and pungent. Virya is the active principle of that particular substance by which it acts, it does the action. So virya is the potency or the active principle, and vipaka is the transformational rasa. The original rasa, when it comes into contact with the digestive fire, it gets transformed into 3 different types of rasas, which is sweet, sour, and pungent. So like that, we will study. Gugulu has the rasas. If we taste it by the tongue, we will see that the rasa is bitter, which is tikta, astringent, which is kashaya, and pungent, which is katu. Now, this Gugulu is basically bitter, astringent, and pungent. And virya is also hot, which is ushna. And vipak is also pungent or katu. So regarding the doshas, this reduces all the three doshas, but it is also especially effective on the vata dosh and also on the kapha dosh. So Gugulu is the best herb which can treat the different disorders whenever the imbalance of vata and kapha dosh is concerned. Because we look at the rasas, the virya, and the virya, being hot, the potency being hot, it will be effective on the vata dosh as well as the kapha dosh. And as we saw, the rasa and vipak also are given. The dhatu, the dhatu, it acts on the mausa dhatu. Basically, very good. Gugulu is very good as far as the imbalance of the mausa dhatu is concerned, the adipose tissue, the fats, also the meda dhatu is concerned, because it has the bitter, astringent, pungent, and it is also hot in potency. And if we look at the properties of mausa and meda, which is the fats and the adipose tissue in the body, they are completely opposite to this. They are like more similar to the properties of kapha dosh. That's why they have a correlation with kapha dosh, mausa and meda. And Gugulu is exactly opposite in properties to the kapha dosh. That's why it acts on the mausa and meda dhatu. It is very effective as it is having the bitter, astringent and pungent taste as well as hot potency. And it also acts on the asthi dhatu. Gugulu is excellent for the bone disorders. We have been using it since a very long time. Gugulu, again, a very important herb of most of the formulations. As far as the asthi dhatu or the bone related disorders are concerned, and also Gugulu is also effective on the shukra dhatu related disorders. So mausa, meda, asthi, shukra. Now you will be able to understand because you people have now become pro, I think, everything. So rasa, virya and vipak is how the herbs act. So remember the rasa, virya, vipak of Gugulu. Next slide. So the actions of Gugulu are, it reduces the blockages. So something that is bitter, astringent and pungent and also hot in potency definitely will be clearing the blockages. So Gugulu does that. It clears the blockages in the channels. And one of the major reasons why the different kinds of disorders they occur is because there are the different kinds of blockages that are formed in the, say, strotasas, the channels and everything. And Gugulu clears that. That's why Gugulu is very effective. Again, Gugulu reduces the edema. It also reduces the edema whenever there is swelling or something in the body, being bitter, astringent and pungent and hot in potency. It helps to reduce that edema, the excess, maybe fluid retention or anything. It clears that. And it also reduces the enlargement of glands. Now, whenever the imbalances takes place in the body, in the organs or anything, we see that there is either the enlargement or either there is the, we can say, reduction in the size. So either there is a shrinking or either there is an enlargement. So Gugulu, because of the rasa, virya, vipak that it has, it also helps to reduce the enlargement of the glands. So we see when the glands like the thyroid, the prostate and so many glands, when they get enlarged, there are different kinds of effects on the body. And Gugulu helps to reduce that. It controls the vitiated adipose tissue and lipids. Even when the mausa and meda dhatu, like the adipose tissues, the fats, they get increased. At that time also, Gugulu helps to reduce that. So basically, if we consider and put the herbs into two categories, we can understand that, one category of herbs, which we call as nourishing means which will increase something, nourish the body. And the other category of herbs into reducing kind of thing. They will scrap out something that is in excess. So we can make two categories of the herbs. One is the herbs that will nourish, they will increase the volume of something in the body. And the other category is where that herbs will do the scrapping or the reduction of something that has been formed excessively in the body. And Gugulu is a herb that comes in the second category, where it scraps out, where it reduces the excess formation in the body. Now that excess formation can be anything. It can be an enlargement, It can be, say, because of the water retention, the swelling. It can be due to the blockage, anything. So Gugulu clears that. So like this, now we will understand the different kinds of herbs. So this is Gugulu. You can see in the picture. The Ayushakti supplements that contain Gugulu, they are Fibron, Granthihara tablet. So Fibron is also called as Granthihar here in India, and the quantity is given 167 milligrams. And U-tone, which is again very effective, and it contains Gugulu, and ketone, and the quantity of Gugulu in it is 150 milligrams. So now again, if we look at the the supplements where we use in the different disorders, it is because of the Gugulu content, and it helps to remove out the excess formation in the body. Like for example, fibron, Granthihar. The name itself suggests, whenever there is an excess formation of some, say, cyst or some enlargements, there definitely we use Granthihar and fibron, because there we need that scrapping action, that reducing action. And one of the main herb in that is Gugulu. Then U-tone and ketone also. So this is about Gugulu. Next slide, please. Then the next herb is Arjun. I think Arjun you have seen in the garden, herbal garden, that forest that we visited. Latin name is Terminalia arjuna, and English name is the Arjun tree. It exactly looks like this. It is a very big tree, Arjun. So this is, yeah, next slide. Arjun, the rasa is astringent. It is kashaya. This is very important. Arjun is astringent in taste. Okay. Virya, potency, is cold. Remember all these things. Vipak is pungent or katu. So astringent rasa, kashay, cold virya, which is sheep, and pungent vipak, which is katu. And regarding the doshas, it is effective on the pitta and kapha doshas. And regarding the dhatus, it is effective on the rakta dhatu, the meda dhatu, and the asthi dhatu as well. So rakta, meda, and asthi dhatu. Arjun is effective on all this dhatu, on all these dhatus, because of the rasa virya vipak that it contains. Now, one important thing about Arjuna is that it has a prabhav. We have studied prabhav. Again, I will repeat what is prabhav. Prabhav is the, we can say, special action, irrespective of the logical reasoning why the rasa virya vipak is like that. It does not have to be in that way. So prabhav is a special effect, we can say, which we cannot reason, we cannot think about it like that. So one of the special actions of Arjuna is that it is a very good cardiac tonic. It is called as Hrudya. It works on the heart very well. It acts as a cardiac tonic. That is the prabhava of Arjuna. So that's why it is very good whenever the heart related disorders are concerned. It gives strength to the cardiac muscles. It improves the cardiac functions and the rhythm. It corrects the heart rate. We can see, explicitly Arjun acts on most of the cardiac related disorders because that is the prabhav of Arjun. And it enhances the quality of Rakta Dhatu. We saw that it acts on the Rakta Dhatu. And because it is astringent, we saw the taste of Arjun is astringent. So that's why it also acts as hemostatic, or it stops bleeding. Always remember there are two things, two principles. One is that something that is astringent, okay, something that is astringent will definitely stop the flow of fluids. Something that is astringent will stop the flow of fluids. It can be blood, it can be bleeding, it can be, vomiting, it can be diarrhea, it can be anything. So astringent taste has that capacity to stop the excess flow of liquids. And second principle is that anything that is cold in nature, that also has the same capacity to stop the flow of certain things. So we saw that Arjun is astringent as well as cold. So that's why it acts as a good hemostatic and it stops the bleeding. So cold and astringent, these two have got the properties of stopping the flow of the, we can say, different kinds of fluids. And Arjun is also effective because it reduces the edema. So we can see the pictures in the Arjun is given. So cardiac tonic, remember that is the Prabhav, and it helps with the correction of the heart rate. It improves the cardiac functions, strength to the cardiac muscles. It acts as hemostatic, stops the bleeding, and it reduces the edema. So we'll go to the next slide. Now the Ayushakti supplements that contain Arjun, they are Heartone, the Jeevan Rakshak tablet, 230 milligrams it contains, then Meta Boost, 50 milligrams, and Mind Power, which is 30 milligrams. So all these supplements, they contain Arjun, Heartone, Meta Boost, and Mind Power. Then next slide. Next is Draksha. So the Latin name is Vitis vinifera. English name is the grapes, which we all know. So Draksha, yes, next slide. Now again, always remember there are two fruits in Ayurveda, the classics, which are said to be the best fruits. Which are they? Anyone can guess? So that I know.
Amla?
With me.
Pomegranate.
Yeah, okay. Yes. Anyone else?
Pomegranate and grapes.
Pomegranate.
Pomegranate.
Pomegranate and
Pomegranate.
grapes.
Yeah. So everyone is awake. I got to know that everyone is awake, and yeah, some of your right, your answers are right. So pomegranate and draksha. They are the two. Yeah. Now you can mute yourselves. So pomegranate and draksha are the two fruits which are said to be phalottama, best fruits. Avla is also the best fruit, but yeah, draksha and this pomegranate and grapes are said to be the best. Okay. So rasa is sweet, which is madhur, and astringent also. So everyone must have tasted grapes. They are not completely sweet. There is a little astringent taste to it. So sweet and astringent. Virya is cold, which is shita virya. Vipak is sweet, which is madhur. And regarding the doshas, it is effective on the vata and pitta doshas. Okay. It is specifically, pitta related disorders. Daksha is very helpful. And regarding the dhatus, it acts on all the 7 dhatus, but especially on the rasa, rakta, mausa, shukra, and asthi dhatu. Okay. Rasa, rakta, mausa, shukra, and asthi dhatu. Next slide, please. The actions of draksha. Now, again, if we look at the category of herbs, which are called as cardiac tonics, in that we find draksha specifically, because draksha is very good for the heart. It acts as a cardiac tonic. So there is a group of herbs, in Charaka Samhita, there are 10 group of herbs which are given as the best cardiac tonics. So draksha is also one of them, and it helps in the bleeding disorders. It works on the agni, that is the digestive fire, and it improves the tissue nourishment. Now, draksha is a herb which we will put under the first category, the category of nourishing herbs. Like gugulu, we have put it under the second category, which is the scrapping or reducing kind. Draksha, we will put in the category of nourishing. So it helps to do the improvement of the tissue nourishment and works on the digestive fire, and it's a good cardiac tonic. Next slide, please. So the Ayushakti supplement that contains draksha, it is Heartone, which is Jeevan Rakshak, and Toxigo, which is the Ampachak, and the quantities are given. So draksha is found in Heartone and Toxigo. Okay. Next slide, please. So next is Jahar Mohra Pishti. So Latin name is serpentine and English name is also serpentine. Next slide, please. So Jahar Mohara Pishti, if we look, it is a rasa which is astringent, kashaya. The virya is hot, which is ushna, and the doshas, it is effective on the vata and pitta doshas, and the dhatus, it is effective on the rasa and rakta. So Jahar Mohara Pishti. Next slide. We have taken this because again it is a very good cardiac tonic, and today we are studying the herbs which are beneficial for the heart. It helps in the cardiac health issues. It is a good cardiac tonic. It is a good brain tonic. It has anti-poisonous actions, and it improves the ojas. Ojas, I think everybody knows. Ojas is the immunity. The gist of all the 7 dhatus is called as ojas. So Jahar Mohara Pishti acts on the brain as well as the heart, and it has an anti-poisonous action, which is very important, and it also helps to improve the immunity. Next slide, please. Yes, so Jahar Mohara Pishti is found in Hartone, which is the Jivan Rakshak tablet, then Meta Boost, which is the Suruday, and Mind Power, which is the Mind Power, yes, 25 milligrams. So Hartone, Meta Boost, and Mind Power, they contain the Jahar Mohara Pishti. Next is Amlavetas. Latin name is Garcinia pedunculata. English name is stalked mangosteen. Amlavetas, again another herb which is a good cardiac tonic. The rasa is sour, which is amla. As Amlavetas, the name itself contains the word amla. Then virya is hot or ushna. Vipak is sour or amla. The dosh, it reduces the vata and kapha doshas, and slightly it increases the pitta dosh, because we know, it is hot as well as it is sour. And the 3 rasas that increase pitta dosh, which are they? The 3 rasas which increase pitta dosh, can anybody answer?
Sour, hot, spicy, and pungent.
Yes, sour, hot, spicy, and pungent. They increase the pitta dosh. And Amlavetas is sour as well as hot. That's why slightly it may increase the pitta dosh, but it reduces the vata and kapha dosh. And regarding the dhatus, it is effective on the rakta dhatu. Next slide, please. It is useful for the cardiac debility and pain. It promotes good digestion. Amlavetas is really good to promote digestion, to act on the digestive fire, because it's sour things, and it is hot also. So it helps to increase the digestive fire and promote good digestion, and also useful for cardiac debility and pain. Next slide, please. So the Ayushakti supplements that contain Amlavetas, they are Meta Boost, which is Suruday, then Anulom and Supachak. So Meta Boost, Suruday, Anulom and Supachak. Yes, next slide. Pushkar Mool, yes, another very important herb is Pushkar Mool. It looks like this, as shown on the slide. The Latin name is Inula racemosa. English name is Indian elecampane, if I'm pronouncing it right. Inula racemosa, Pushkar Mool. Yeah, next. Yes. So rasa is bitter, which is tikta. Virya is hot, ushna. Vipak is pungent or katu. Regarding the doshas, it is effective on the vata and kapha dosha. Being bitter and hot, and vipak is pungent, so it is very effective on the vata and kapha dosha. And regarding the dhatus, it is effective on the rasa dhatu and the rakta dhatu. Next slide, please. Pushkar Mool is useful in the ischemic heart disease. It is useful in the high blood pressure, like beta blockers, anti-inflammatory action, antihistaminic action, and it reduces the fats and cholesterol. So we saw that, because it is effective on the kapha dosh and also on the vata dosh, and being bitter, hot, and pungent, it definitely reduces the fats and cholesterol. because fats and cholesterol are related to the Mausa Meda Dhatu and Kapha dosh. So Pushkar Mool helps to reduce that. And at the same time, it also helps in conditions like high blood pressure. It has an action like the beta blockers. And it is also anti-inflammatory. It is proven to be anti-inflammatory, and it has an antihistamine action also, and useful in ischemic heart disease. The Ayushakti supplements that contain Pushkar Mool are Meta Boost, that is Suruday, Heart Tone, which is the Jivan Rakshak, and the quantities are given. Yes, next. Then we go to Tagar. Now this Tagar also you must have seen in the forest when we went in the education week, the white flowers. I think this Tagar is looking little different. Latin name is Valeriana velici. English name is Indian valerian. So Tagar. Next slide, please. The rasa is pungent, katu, bitter, tikta, astringent, kashay. So pungent, bitter, astringent. And virya is hot, which is ushna. And vipak is also pungent. Okay. Like little same to gugulu. Then dosh effective on all the three doshas. It acts on the rakta dhatu and the majja dhatu. Yes, next slide, please. So this Tagar again has a prabhav, we can say. The special action is that it reduces the high blood pressure. That is the prabhav of Tagar. It has been given in the classics and in the different scriptures about Tagar. Very effective to reduce the high blood pressure. It reduces the headache. It is useful in the psychiatric disorders. Again, Tagar has this special effect of being useful in the psychiatric disorders. That is also the prabhav of Tagar. It is good for the eyes and effective in epilepsy. Now, let me tell you about in short about epilepsy. Now, epilepsy, as we know that it's a condition where the person gets it's related to the nervous system and the psychological disorder, and the person gets fits and he becomes unconscious. He falls down to the ground and everything. According to Ayurveda, what is epilepsy is, again, it is related to apasmar. It is called as apasmar, and it is a psychological disorders. There are two main psychological disorders which are described in Ayurveda. One is the unmad and second is the apasmar. If we look at the causative factors of unmad and apasmar, as as a whole psychological disorders, it is related to the raja and tama doshas. So whenever the raja and tama doshas, they get excessively increased and the sattva, it gets reduced, then there are different kinds of psychological disorders. Epilepsy is one of them. So Tagar is effective in epilepsy. And also the psychological disorders have to do with the manovaha strotas. The different strotasas we will study later. So there are different strotasas for everything. There is also a manovaha strotas through which the mind functions, they take place. So when the manovaha strotas is by any chance imbalanced, blocked, deranged, then there are different psychological disorders. And herbs like Tagar, they work on that manovaha strotas, they work on that rajatama and sattva, and they balance it. That's why they are effective in the psychological disorders as like epilepsy. Next slide, please. The Ayushakti supplements that contain Tagar, they are Rakta Shanti and Bliss. Rakta Shanti and Bliss, they contain Tagar. Then we move towards the herbal supplements. Just move the slide little slowly, Vinay Bhai. Yeah. Fibron is Granthihara tablet. So as the name Fibron and in the bracket Granthihara. So Granthi means anything which is a enlargement, anything which is we call it as maybe a tumor, a cyst, or anything that is called as Granthi in Sanskrit. And Hara means removal. So literal meaning of Granthihar is removal of any kind of enlargement, cyst, or tumor, or anything that is a solid structure in the body, a solid mass in the body. That is the meaning of that tablet, and it really acts on all these conditions. So whenever there is a formation of a hard mass in the body, which is unwanted and which is excessive growth, fibron or granthihar acts on that. And why it acts on that is because of the herbs that it contains. First is Shuddha Guggulu that it contains. The Latin name is Commiphora mucul. Then Kulinjan, which is Alpinia galanga. Then Bharangi Ghana, Clerodendrum serratum, Shunthi, which is the Gingiber officinale, Punarnava, Borevia diffusa. Quantities are given. If we look at the quantities, Gugulu is there in the largest quantity, 167. After that, there is this Kulinjan, 133, Bharangi and Shunthi. They are there in 67 milligrams and Punarnava in 50 milligrams. So, Gugulu, Kulinjan, Bharangi, Shunthi and Punarnava. They are the contents of the fibron or Granthihara. Okay, next. Now, indications, like I told you, very easy to remember from the name, fibron or Granthihara. So something that is unwanted in the body, a mass, a solid structure, it can be anything, an excessive growth of cells. For that purpose, we use the fibron or Granthihara tablet. So indications are first blockages. So whenever there is a formation of something unwanted, it will definitely create blockages. So whenever we find that there are certain kinds of blockages, Granthihar or fibron is to be used. Different kinds of cysts. So cysts are again the excessive production, the excessive growth of the cells. So cysts, then tumors, again tumors is the same. And whenever there is an inflammation, because all these processes, whenever the excessive growth formation takes place, it starts with the inflammation in the body, and then only it proceeds further gradually, forming the hard solid mass structure. So in all these cases, fibron or Granthihar is extremely effective. Okay, next slide. So property of the tablet is, now again, when we are calculating these properties, I want to make it clear, is sometimes, we have not put all the contents of the herbs here. There are some contents of the herbs that we have put, maybe there are some more herbs. And the property, overall property that we are calculating, it is an overall property taking into consideration all the herbs that it contains. Maybe they are not in the slide. Okay, we have put only the main herbs in the slide. So not to have the confusion that why it was cold and then it is hot, that is not the case. It is an overall calculation of all the herbs on an average. So fibron Granthihara, the property is hot or Ushna. The dosage in adults is 3 tablets twice daily. It is quite a high dose, 3 tablets twice daily. And contraindications, of course, during pregnancy, we do not want to use fibron or Granthihara. It is not at all beneficial. So wherever, how to know where to use it, wherever you find that there is an unwanted growth, excessive growth, a hard solid structure in the body, there we use fibron or Granthihara. Next slide, please. Hartone or Jivan Rakshak. Again, some of the herbs of this Hartone or Jivan Rakshak are given. First is Arjuna Ghana, which is Terminalia Arjuna in the highest quantity, which is 230 milligrams. Then Draksha Ghana, which is the y2s vinifera, 100 milligrams. Jahar Mohra Pishti, 3 of the herbs that we saw today. All the first 4 herbs we have studied today, they are the contents of Hartone. Remember it that way. Jahar Mohra Pishti, which is serpentine, it is present in 100 milligrams. Pushkar Mool, which is the Inula racemosa, it is present in 50 milligrams. So Arjuna, Draksha, all in the Ghana form, in the extract form. Then Jahar Mohra Pishti and Pushkar Mool, which we have studied today, they are the contents of Hartone or Jivan Rakshak tablet. Trikatu, again Trikatu is the combination of the 3 herbs, which are Piper longum, Piper nigrum, and Gingiber officinale. So, Shunthi, Marich, and Pippali. Trikatu is a combination of Shunthi, which is Gingiber officinale, then this Shunthi Marich, Marich is Piper nigrum, and Pippali is Piper longum. So, Trikatu is a combination of these 3 herbs. They are there in Hartone. Next slide, please. So Harton or Jivana Rakshak. Again, if we look at the Sanskrit meaning of this bracket word, Jivana means life and Rakshak means to protect. So the meaning of Jivan Rakshak is to protect life. To protect life, what is the main source of life in our body? The heart. Because heart is said to be the center, of the mind also. According to Ayurveda, Rudayam Chetana Adhishthanam. Rudayam Chetana Adhishthanam. Rudaya means heart. Chetana means consciousness. Adhisthana means location. The location of Chetana or consciousness in the body is the heart. And the heart is also the location of the mind, the emotions, whatever, and also the consciousness. So we can say mind as well as the whole consciousness, it is located in the heart. That's why when the heart stops working, everything stops. Okay. If the brain stops working, still, body can go on. But when the heart stops working, everything stops because it is Chetana Adhishthanam. It is the location of the consciousness. That's why whenever heart disorders are concerned, it is an emergency condition. Indications are heart health issues, heart debility, palpitations, emotional disturbances, and stress. Now, here we have to remember that, as I told you, that the mind, where is the location of mind in the body? According to Ayurveda, it is in the heart. It is in the Chetana Adhishthanam. It is in the Rudayam. That's why whenever there are heart disorders, definitely it has an impact on the mind. And whenever the mind is disturbed, it will have an effect on the heart. That's what we see in cases of emotional disturbances or fear or anxiety or depression. Definitely what is affected is the heart rate, the pulse, and everything is affected. All the functions in the body is affected. So that way also we have to understand how to use these tablets. Once we understand the principles behind what is what, then we can know, the various angles where we can use these herbal supplements. That's why I'm giving this extra description. And also it is used in conditions of stress. So Harton or Jivan Rakshak tablet, it can be used in the conditions of stress also. So like this, we have to think whenever we are dealing with the herbs, and we have to apply the concepts till now, whatever we have learned. Then it will be easier for us to know where to use it. Next slide, please. Sorry. So Harton or Jivan Rakshak tablet, the overall property is hot or Ushna. The dose in adults is 2 tablets twice daily. And in children, it is 1 tablet twice daily. Contraindications are during pregnancy, not to use. Generally, during pregnancy, we avoid a lot of herbs. There are only some herbs which are specially maybe designed for pregnancy, like Garbharakshak or something that we use. Otherwise, in pregnancy is such a condition where, we avoid the use of most of the herbs. Next slide, please. Then Meta Boost or Suruday. So Suruday, again, I will explain the meaning. Su means good, beneficial. The prefix Su is a prefix. Whenever the prefix Su is used somewhere, you will find many words in this Sanskrit. There is a Sukanti cream also in Ayushakti. Sukanti, if someone must have seen, a Sukanti skin cream is there. So Su again is used there for beneficial, and Kanti means skin. So beneficial for the skin. That's why Sukanti. Like that, Suruday. Su, the prefix is used when the meaning is beneficial or good, like that. And Ruday means heart. So Suruday is something which is beneficial for the heart. So the herbs that it contains, Jahar, Mohra, Pishti. Right now we studied it today, serpentine, 23 milligrams. Abhraka Bhasma. Now Abhrak Bhasma is a metal. Abhrak is a metal which is mica. Again, mica has great benefits. One of the contents of Maharasa. Again, Maharasa is another concept which we will not go into details. But yes, Abhrak has great benefits. Abhrak has very good effects as far as the mental faculties are concerned, because it really works on the Akasha Mahabhut, and it works on the mind. Whenever there is a, we can say, cluttering of thoughts or something, confusion or something, at that point, Abhrak works very well on the Manovah Srotas and, on the Akash Mahabhut. So that way, Abhrak is a very good, we can say, having good properties, a metallic metal which has good properties. Then Amlavitas Ghana, Garcinia pedunculata, 29 milligrams. Then Arjuna Ghana, Terminalia Arjuna, 50 milligrams. And Pushkar Mul, that is Inula racemosa, 86 milligrams. So today we have studied Jahar Mohra, Amlavitas, Arjun, Pushkar Mul. They are the contents of Meta Booster Surday, and one is their Abhrak Bhasma, mica, which I have told you, it works very well on the mind. Next slide, please. Metaboost Suruday, the indications are to use it in angina, low circulation, whenever we find low circulation in the body, and mostly it causes several kinds of disorders related to the heart, even the psychological disorders, many disorders in the body. So there Metaboost or Suruday can be used. The heart health issues, heart debility, whenever the heart has become weak due to some reasons, that time we can use Metaboost or Suruday. Next slide, please. The oral property of Metaboost or Suruday is hot or Ushna. The dosage in adults is 2 tablets twice daily, and in children it is 1 tablet twice daily, and contraindications are during pregnancy. Most of the times you will find that pregnancy is a contraindication. Remember, not to give any herb in pregnancy, always to look whether it is required or not. But most of the times in pregnancy, most of the herbs are contraindicated, unless and until they are designed for that condition. Next slide, please. And then Rakta Shanti tablet. So Rakta, blood, and Shanti is pacifying, or we can say reducing, or better word is pacifying. So pacifying the blood, and that is the role of Rakta Shanti tablet. So whenever the blood is vitiated, imbalanced, so to pacify that, we use Rakta Shanti tablet. So the herbs that it contains is Brahmi Ghana, Centella asiatica, 50 milligrams. Then Neera Brahmi Ghana, which is Bacopa monieri, 100 milligrams. Tagar we have studied now, Valeriana valechi, 150 milligrams. Arjuna Ghana, Terminalia Arjuna, 100 milligrams. So we saw Brahmi, Neer Brahmi in the forest, Arjun Tagar. So all these are the contents of Rakta Shanti tablet. Next slide, please. So Rakta Shanti basically is the best for high blood pressure conditions, high blood pressure and anxiety. So generally we see, whenever there is a heart related disorder, it has to do something with the mind as well. And, anxiety and the fear and everything, we know that it increases the blood pressure. It has a direct effect on the heart rate and everything. So Rakta Shanti tablet acts on all these conditions. And as we saw that it contains Brahmi, it contains Neera Brahmi, which also act on the mental capacities, as well as they are good for the heart also. So something that is good for the heart also has to do with the mind. It is good for the mind also, because I explained the Chetana, Rishthanam, Hrudayam and everything. So the indications of Rakta Shanti are high blood pressure and anxiety. Next slide, please. The oral property of Rakta Shanti is cold or sheath. The dose in adults is 2 tablets twice daily, and contraindications is low blood pressure. Now these things you must remember. Whenever there is a contraindication, even if you forget the indications, always remember the contraindications. This was taught to us in our college, by our professors, that always to first remember the contraindications. Never use that particular thing in that contraindications. Be very cautious, and then you go to the indications. So Rakta Shanti, for that, the contraindication is the low blood pressure. The low blood pressure is the contraindication. The next slide, please. And now we go towards the case studies. So this is a case study of this client. of, he was heart blocks. He was having heart blocks. And this client Deepak, just a minute. So 48 years young, and he had 3 heart blocks, and each block, the arteries, the block was around 70%, around 70%. And he had 3 heart blocks like this. And because of which he was feeling breathless after doing minor physical activity. Whenever we have such clients, who we see that after coming to us, walking few steps, they are having difficulty in breathing. That is always a thing of concern. And definitely we have to do the investigations and, think about the heart blocks and everything. So this was the same client. He was getting breathless even after walking, few 10 steps or something. He was having severe breathlessness. He had pain and heaviness in the chest area. And his concerns were he felt cyanosis on and off. So cyanosis is, when the blood, the oxygen levels go low in the blood, and then it tends to have a bluish color to the skin, especially the fingers, they become like that. And he was advised to go for angioplasty because of this 3 heart blocks. And when he came to us, we asked him to avoid any kind of strenuous activity of the heart and improve the cardiac health. So whenever we are talking about the heart, as I told you, it is the Chetana Adhishtanam. The whole consciousness lies in the heart. One of the main vital marma points, or one of the main vital points in the body, which when slightest, we can say, injury or disturbance can take away the life. So we have to be very careful, and we have to carefully ask the client to avoid any little stress. Also has to be avoided in such conditions. So that was advised to him. A customized diet plan was given, considering all these conditions that he had. And the herbal supplements that were used were Fibron, which is Granthihar, Heartone, Jivan Rakshak, and Metaboost Suruday. So basically, these 3 herbal supplements were used: Fibron, Heartone, and Metaboost. And we just now saw that they contain, see, why Fibron? Because there was a excessive blockage. Something was excess that was blocking. So Fibron and Heartone, because it is effective, it's a good cardiac, it contains herbs which are good cardiotonics, and Metaboost. So all these herbs were given. And after 1 month, what we saw was he felt 50% better. The cyanosis issue, which was there, the bluish color to the skin, especially the fingers, it was almost gone. And after 3 months, his symptoms were reduced by 90%. He could walk without feeling breathlessness. So a client who was not able to walk 10 steps, and he was feeling breathless, so he was able to walk without feeling, breathlessness. And his cardiologist advised that, there is no longer a need for angioplasty. Many times it happens that, when the clients are advised, big surgeries or something, even the angioplasties, or maybe it is a knee replacement surgery or some kind of surgery, they definitely resort to the Ayurveda, and they come here and they see, whether the alternative therapies they work. And definitely Ayurveda has a solution for this, and this is evidence for that. And he no longer needed that angioplasty. And this client is still following the diet plan. We have to be consistent after that also. We cannot leave him like that. So he's still following the diet plan religiously, using the home remedies, and doing the yoga as well. So his cardiac health is better now. So whenever these conditions are concerned, we have to work on the whole body, considering mainly the heart, mind, and every aspect. The stress factor has to be gone. It has to be avoided. And we have to carefully monitor with the help of the diet and lifestyle. And of course, the herbal supplements, like here in this case, Fibron, Heartone, and Metaboost. So like this, we can give results to the client. Next slide, please. Yes. So this is the case study of heart muscle weakness. So we can see before it was 25%, and after it increased and became 40%. So this is given in the slides. So we can see that. Next slide, please. case study of this angina, which is chest pain. This client Uttara. So she was 48 years young. The symptoms were chest pain she was having while doing physical activities for over 2 years. And concerns were again shortness of breath and chest heaviness. She was having the shortness of breath and chest heaviness. In females, generally, we find that, the incidence or prevalence of heart disorders is less. But nowadays, due to the, we can say, excessive stress factor or the changed diet and lifestyles, we find that even females are suffering from different kinds of heart related disorders. uh, so she was having the shortness of breath and chest heaviness. When she came to us, we gave her a customized diet plan and herbal supplements like MetaBoost, Suruday, Heartone, Jivan Rakshak, Brain 2, and Sumedha. And the therapy that was advised to her was Heart Dhara. So see here, what we did was, again, we gave her the herbs, mainly the herbs Suruday, MetaBoost, Heartone, Jivan Rakshak, Brain 2, Sumedha, and specifically Heart Dhara. So I think everyone must have experienced Heart Dhara, or you must have seen Heart Dhara is a procedure where, we focus on increasing the functions of the heart. One of the therapies in the Panchakarmas like Heart Dhara, it works fantastically on all these conditions. It helps to improve the functioning of the heart. And in this client, what we found was, she was doing excessive physical activity, which had affected her heart, one of the vital murmur points. And when we gave all these therapies, it helped her to calm down, and it helped her heart to function better. And the results were recorded as after 2 months, the shortness of breath was reduced. After 4 months, the chest heaviness was reduced. And after 6 months, the chest pain was reduced. And after 9 months, he had 80% improvement. Next slide, please. She had 80% improvement. Yes, next slide. Case study of high blood pressure. Again, this was published in the American Journal of Medical Science and Pharmaceutical Research on Hypertension. This is published here. The link and everything is given here. Yes. So we found that you can afterwards look at this case study. I think recently this was published and it was circulated in the group also. Next slide, please. Yeah, so we come towards the end of this session. Though we don't have Cornelia today. So the challenge activity is to, yeah, can we go to the challenge activity? Just Vinay Bhai. Yeah. So to use a herbal remedy and observe its effect during the month and share the experience in your path group. So this is the challenge activity, as every time we say that unless and until we use it and see the changes, whatever we have learned, we cannot experience. So this is the best way to do it. So thank you very much and namaste. I think we have
Raju was the first hand up, Dr. Kamal.
yeah, we have Dr. Hemang. Yes, he will be here. He will answer all the questions. It's Dr.
Yes.
Yeah.
Good morning. Namaste. Nice. Good. Good to see you again. Now again through screen. No more in person. Yes. Debra, Mary, Russell, all are there at Ayush Shakti. Great. Yes, Dr. Rene. Wow. Super, super. Wonderful. Nice, nice, nice. Thank you, Dr. Komal. Yes, Jan, sleeping. Yes, Monday. Many people have Paman, Virechan. Huh? Good, good. Yes, Radu.
Dr. Hemant,
Yes. Yes.
I'm trying to I'm trying to find you on on the screen, but for some reason I don't see you. But
I am very,
all right.
nearby you. Nearby you. Not so far.
I have three questions about
Please.
some of the things. One is a product that, no, it's not possible. It's a pomegranate molasses. Could this be used instead of vinegar?
For what purpose you mean to?
Just to put in salad for sour taste.
Yeah, for sure.
Pomegranate molasses.
Yeah, it's fine. Compared to vinegar, yeah, it's much better option.
All right, thank you.
Yes.
Now, coming to the other two, could Grantihar be used in gout?
Granthir,
Grantihar in gout.
Granthir not required in gout. Gout means uric acid is high.
Exactly.
So in that, Google is helpful. U-tone is helpful.
All right.
Virechan is helpful, but no Granthir. Granthir has no role. Granthihar means where the problem in the, like a kind of the growth, extra unwanted growth, tumor, nodes, nodules, fibroids, blockages, cyst, any growth. If we want to melt, break, then it is necessary, Granthir. In the gout, it is not a case.
Because what I've seen is also like building rigidity into the tissue and like petrifying between the bones. So I thought that it might also melt with Grantihar, but okay.
Yeah, you have a good logic. Maybe we can try on a couple of clients and see that there won't be any harm by giving it. But we never tried it, honestly. We never thought this way. It's a good idea to give it. We can try.
Okay, thank you. The other one would be about Rakta Shanti.
Yeah.
Because I heard that it's not good in lower blood pressure, but I had someone, actually it was happening 2 days ago, and she has high blood pressure and then very low blood pressure. So it's all included into the symptoms of menopause. So I was giving to her Rakta Shanti as well as Harton together along with Marma, and yeah, it was in very low blood pressure at that point, but somehow things were settled very well with that, and also with Marma. So I'm just thinking, when is the blood pressure going up and going low? wouldn't be better just to give both of them, or how would we deal with that?
Yeah. Good question. Now, in this type of the dual situation, it's a sensitive case where the blood pressure is on higher and very next moment it can be lower. We have to be careful in giving Rakta Santi, but it is necessary to give to balance the blood pressure. So we give it as 1-1, not 2-2. Instead of 2-2, we give it only 1-1, so
Only
it will
1-1.
remain stable. It won't go down.
Yeah.
Just, and yes, hard-on is good, but if even with the Rakta Santi 1+1, you think that it is still dropping, it's going down, lowering, then you add Meta Boost 1+1.
All right.
By any chance, if you see that 1+1 Rakta Santi is not enough, not able to balance the blood pressure, it's on the higher side, you need to give 2+2. You can give it 2+2, and in addition to that, you give Rakta Santi 1+1. Surudai Meta Boost 1+1. So it will help to prevent from the lowering. Low blood pressure also not good. Meta Boost will help to at least maintain the circulation, and it will trigger some pressure point. So it won't go the beyond level, like not below the level.
No, one more, because you mentioned Meta Boost, and she has also very high hot flashes, to extreme.
Yeah.
And Meta Boost, as far as I know, could increase the pitta, which is
Yeah.
one of her problems as well.
Yeah. So as you mentioned, it's a menopause syndrome. It's a changing of hormone, and that's why heat waves are there. So the exact combination is Stri Sanjeevani, Chandrika Ras, Meta Boost, Brain Toe. This is the proper combination to suggest during the menopause period. This fluctuation in the blood pressure is a side complication during menopause. So main combination should be like this: Chandrika Ras 2+2, Brain Toe, Sri Sanjeevani, and Meta Boost. Yep.
Okay. Thank you very much for this.
Yes, welcome. Good.
Thank you. Thank you.
Good. Nice. Nora. Sorry, Nusrat. Sorry.
Hello, everyone. Thank you once again for this
Hello.
very, very interesting session. I have two questions concerning fibron. Can it be used as well as body inflammation, any general inflammation in the body, which can be due to many things?
Inflammation. Now, suppose if you give an example, then I can say yes or no, like whether it is helpful or not. Like if I give an example, like AVN, avascular necrosis. Okay, it's an internal inflammation. We don't see outside, but it creates the blockage inside. Circulation gets blocked. And that's why the necrosis is happening. Like a varicose vein. Also the internal problem. So in this situation, in these conditions, we are giving fibron, Granthir.
I was thinking more of, for example, if somebody has no cartilage like myself, and the bones are rubbing, creating friction and a lot of inflammation, would that be useful in that condition or not at all?
No, better you give Ampachak. Toxico is better for you.
Okay.
Suruday along with Ampachak. So that creates like a, that, yeah, helps in that situation. It's the right combination.
And in case of, could fibron be used as a blood thinner? I don't know any Ayushakti remedy that would be used as a blood thinner. Blood clots that form for any unknown reason. Would it be as a preventive measure or not?
Yeah, Granthir is helpful to remove the blockages. We cannot say as a blood thinner, but it is blood to remove the blockages. Now, we cannot compare exactly with the blood thinner, but there is a remedy which works in the same principle. Suniram. It cleans the blood. And one of the ingredient, it's Acacia catechu. It's a khadir. It's a helpful, it works, and it has a quality, it has the effect as a blood thinner. And that is one of the ingredient in Suniram. When Suniram removes the toxins, ama, from the body, from the blood tissues, automatic blood will become more clear and thinner. So logically, we can consider it as a blood thinner, but we can't claim it as a blood thinner. It cannot be a replacement of blood thinner.
No, but it could be an adjuvant and help to avoid any blood clots that could happen for no reason.
Yes. Yeah.
Unexplainable blood clots.
Yeah. Yes, that is possible.
Yeah, because we'd seen it, we learned about Suniram in skin conditions, that it helped clear the Rakta Dhatu.
Correct.
And my last question, if I may, concerning raisins, are fresh raisins and dry raisins, do they have the same quality, function as mentioned in the course?
Fresh raisins means what? Grapes?
Grapes, the fruit itself, yes.
No, both are different. Grapes are grapes. It's considered as a sour quality, sour taste, all the effects like inflammatory, pitta, kapha, all those, where this dry resin, it's considered as a sweet. It increases kapha, its cooling effect. So when there is a heat, wherever in the body, in whichever situation, whichever condition, heat in the body, hot feeling in the body, acidity in the body, and like it, then we ask them to soak 20 black resins overnight and the next day morning to chew it before breakfast. It's very helpful, but also to be careful with diabetic condition because it's a sweet.
Mhm.
So both
Thank
are
you.
different.
Thank you. And lastly, pomegranate, because of its rasas, astringent, bitter, a bit of sourness, would not be advisable in Vata conditions then? Or is it okay to have some once in a while?
Yeah, somehow pomegranate is okay for all the three conditions, Vata, Pitta, Kapha.
Okay.
It can be taken normally in the most of the condition. It can be taken. It has a best quality antioxidant.
Exactly, for increasing immunity purposes.
Yeah.
And the
So
taste
it
is just
helps in the all. Yeah. It helps in the all the situations. Normally, we haven't seen any complications, any side effect, any problem from the pomegranate. Normally, we allow this pomegranate to most of all.
well, I really enjoyed it when I was at the clinic, but suddenly because of the rasas, I just wondered if it could influence the Vata conditions. So thank you so much for all
Yeah.
these.
Dr. Hemang.
Yeah. Yes.
Yes.
Tom. Wow.
Yes.
Good
Hi.
morning. Yeah.
Yeah, I just wanted to point out that you probably want to have a little bit of caution with pomegranate juice if there's constipation, because it will
Yeah.
aggravate constipation. Yeah, that would be
Yeah,
the
that
only
is true.
contraindication. Yeah.
Yeah, that is true. Thank you. Yes, very important. So if someone has already constipation tendency, then they need to be more careful in taking this. And
But it's
pomegranate,
very
we recommend the
effective.
home remedy.
Yeah, very effective home
Yeah,
remedy for
home
diarrhea, loose stools. Yeah.
remedy. Yeah, pomegranate juice, pomegranate skin decoction from pomegranate skin. Very useful. Good. Nice, Dr. Tom. Thank you. Super. Yes, Apsane.
Hi, thank you very much. I miss you guys so much. Dr. Komal, I miss you in particular, as we used to sit and talk long hours. I hope to see you in UK. I have a couple of questions. One is about MetaBoost. Isn't MetaBoost given also to increase metabolism? That's one
Yeah,
question.
it is increasing. Yeah.
And does that make you lose weight then?
Yeah, it is.
It does make you lose weight. Number two question. I have a client who's had a stent in the artery 14 years ago. He had 14 years ago, then it wore off. And he came and saw Dr. Smita, but he did not buy the herbs. So he ended up having a second stent. Now, today I was talking to him and I took his pulse and I said, you really need to take the herbs. And I was just wondering, he's just had a stent put in. So can he still go on Fibron, MetaBoost and Heart Tone?
Yes, for sure.
And for how long would he have to take them for? Is that a lifetime or is it just
I think, yes, lifetime, forever.
forever?
Yeah.
Thank you. And thank you for the amazing week. My feet haven't touched the ground yet. By the way, as soon as I landed in UK, the puff on my feet just disappeared totally. I think it was the weather, but thank you for all the love that everybody showed. Guys, that couldn't come. I carried you in my heart. It really was way, way, way above my expectation. It was seriously, seriously amazing. And I believe that this year was probably much, much, much better than last year's week, because it couldn't be any better, to be honest. It was so amazing. I would love to see you all again next year in Easter. Thank you again. Dr. Kumar, are you going to come to UK with Dr. Smita? Are you coming?
We will see. Yeah.
Did she not say anything? The other day she said that would be good, but I don't know where that's gone to. So I'm expecting you with my open heart and open arms. You know? Thank you.
Thank you. Thank
So
you.
nice of you, Apsane. So lovely.
And Dr. Hemong, you're supposed to be on holiday. What are you doing here?
Yeah. Yes. So nice. Yes. It was a wonderful week, very fast and short. Maybe next time we'll have more people and more time. Next time, yes, we will do that. Thank you. Thank you, Apsana. Yes, Aarti.
All right, so I'm appreciating all these questions, and everybody is very, very active and good at learning. It's really impressive. Afsane, hats off, amazing also to see all the recordings on Zoom. It was great. I've heard so many good things of her. It's just mind-blowing. I have two small questions. One, I was recently checking the pulse on a patient who had a stent and cardiac history, and there was a pulse that I felt on the vata and the pitta, where it felt like the pulse was sliding downwards. It was like a waterfall type thing. I felt the pulse going up, and then it was like kind of. Is there any correlation with stent placement or anything like that, or am I feeling something wrong? I don't know. So it was on both these places. And so I see no reaction. So, okay. Second question is the heart dhara. Is this something that can be done on any cardiac patient, or are there some that you cannot do it, where it's not so recommended? And are there any studies on it, on the effectiveness of the heart dhara?
Yes. So, answer to first question about the pulse.
Yeah.
Yeah, there must be some indication. Whatever you have experienced, observed, it must have some message, some information. But like always, many times also explained that only from one symptoms, only from one feeling, we cannot make a judgment. It is always in the combination. It's a one letter. One letter is not the full word.
Mm-hmm.
To make a diagnosis, we need a word, few letters, at least 3 minimum.
Mm-hmm.
Okay. What is the other situation? Then we can understand and we can find out, like it can be this or that.
Okay.
Regarding, there is a specific pulse. There is a specific way to understand if there is some problem with the heart or not.
Mm.
Like in the pulse, sometimes you feel that the pulse, like that the waves are moving, like in the ocean or beach, when you're standing a long way and you are seeing the water is like in this, you just imagine like this. Okay, so same thing is happening in the pulse from the vata to kapha, vata to pitta, and then kapha, like waves. Normally, we always talk to understand vata movement, it goes straight. Straight.
Yeah.
But in the heart problem, it becomes like this, waves.
Yeah.
So it indicates that some problem is there in the heart.
Okay. Mm-hmm.
But here, again, only from these waves, we don't make a diagnosis. We need vata 2 up. We need ama. We need some vata aggravation, disturbance. We need some other additional symptoms. Then only we can say that it is a heart-related problem.
Okay. Yeah, I had 2 patients actually. One was having this downward type of waterfall sensation on the pitta, but also has high blood pressure and was under observation for possible liver enlargement and yeah, has a drinking history and all this type of thing. The other person is an 89-year-old with heart problems and has stent and defibrillator and pacemaker and all this type of thing, and had this this waterfall type of sensation on both, on the vata and the pitta. So otherwise it's doing good. It's actually very active, very drives the car still, is very mentally alert, everything. So and I didn't find too much ama on him, but the other person with the high blood pressure, there was also ama on there.
Yeah. So this waterfall under the pitta finger is problem with the liver.
Okay.
It's exactly that.
Okay.
And that is what I think discussed during the education week on the first day. We explained this. It is the waterfall, like its pulse. Pitta pulse is going in the downward direction, like a waterfall.
Yeah.
That means the problem with the liver.
Okay.
And if the same thing is happening in the kapha finger, means problem with the kidney.
Okay. All right. No, it was not there.
No, I'm just explaining additionally.
Okay. Good. Okay.
Regarding Hardhara, yes, Hardhara can be done in the most of the condition, and yes, it is very good for the effective for improving the LVEF, ejaculation fraction, pumping.
Okay. Okay, so also for a person with a heart attack where there is destroyed heart tissue, and when they have a lower ejection fraction, you can improve their ejection fraction.
Exactly. Hardhara is very effective. Just like still the lady is under treatment at Mumbai clinic, and she started 3 months before treatment. She had a severe heart attack, and then doctor suggested angiography, observed like blockages, breathlessness severe, was unable to walk even 10 steps. When she came first time 3 months before, she was in the wheelchair with the whole family, and I suggested yes. They were reluctant to go for the surgery because the 68 age and very conservative mind. No, we don't want to. I said, okay, let us try. Let us do this Hardhara. But Hardhara to be done first month every day, second month alternate, third month after every 2 days. Then now it's her 4th month and doing after 3 days. She started feeling better just in 3 weeks, no breathlessness. And now completely all right. She's coming by walk and at all, no wheelchair, nothing, absolutely free. In the beginning for few days, like at 1 or 2 weeks, she was coming with her husband and son and somebody, like always together. Now she's coming alone. Hardhara, the course of Hardhara is 4 months, always.
Okay, 4 months.
And first month every day, second month alternate, third month after 2 days, then after 3 days. And then 2 months gap. And then altogether 6 months to ask for the report, another scan or whatever to be done, whatever, just, and to compare it.
Okay.
Of course, along with Hardhara, we need to recommend the supplements like Hearton, Surudai, and if additional anything required.
Okay, good. Thank you very much. That helps. Yeah, thanks.
Welcome. Good. Yes, Apsane.
Sorry, just a quick question. On which finger do I find prostate problem, please? I have a client that was very, very worried about having prostate cancer. Thank God that he doesn't have it. But when I took his pulse, I didn't realize that. I just wanted to know where I should look for it. Please, thank you.
So cancer is under all three fingers. You
Yes,
find
but
all three dosas aggravated.
yeah, I understand that, but he doesn't have cancer, but he does have prostate problem. But I don't know exactly what it is because he didn't know what it was. He just said there is a problem with his prostate gland. And I just wanted to know which finger I would feel it. Would I feel it on water being below navel?
No, like again, it's a combination of the pulse. You feel some beige in this prostate pulse, along with the AMA kidney pulse. You see circulation blocked. You see like there is some unwanted, like this feeling mainly in the kapha finger. It's indicating prostate. But if it is cancer, then all three dosas are aggravated. Then PSA is on the higher side, elevated.
Mm-hmm. So on the cuff of finger, what would I feel? Would it feel funny pulse?
You feel like a AMA kind, like this in the AMA with the kapha finger, kapha pulse going down, means down for waterfall type. You see the heaviness in the pulse,
And
in
it's
the
heavy.
kapha. And the
Okay.
circulation is low.
Low circulation, yes. So what would be the difference between the prostate and the kidney? Because you said we find if on the kidney is going downwards, it's a kidney problem. Is it that the kidney one is not heavy?
No, not heavy, not necessary to have AMA, not necessary to have low circulation.
Okay. Thank you very, very much. Thank
Yes.
you.
Yes.
Oh, sorry, I forgot to say, Arati, Dr. Smita is coming to UK next month. So if you want to send your clients to UK, I will look after them for you. And anybody, if you know anyone in UK who need to see or should see Dr. Smita, she's coming to UK soon in May. I
Could
can
you
actually
put the
you.
information in the chat, because I do have somebody in the UK that would like to do that.
Love to. I
Thank
will do
you.
that. Thank you. Sorry.
Yes. Good. Good. It's a good idea, Jaina. Thank you. I said put it in the group, this itinerary, so everyone can get information there where the doctor is going to. Good. So yes, Robin, you have to ask something.
So I got an email that we were going to have a 5-day pain reduction challenge, and then I didn't get anything else, and it was supposed to start like today on the 15th of April, and I didn't ask when during the India week because I figured I wouldn't. But are we doing the pain challenge right now, and how do we get access and have our own links?
Yeah, I think it has got postponed. Now we will have the new date afterwards. It was supposed to start from today, yes, but due to some technical problem, it couldn't. Yeah, we will have the new dates afterwards. Yet
All
not
right.
fixed.
Thank you.
Yeah. Yes, and we will have all the detail about the access. Yeah. Yes, Andrea?
Hi, Dr. Hemang. Miss you and Dr. Kamal. Want to squeeze and hug you. So Kaylee asked a question, if I may read it. She says, what would you suggest if someone in your family has a stroke or heart attack? What is the protocol that can be given before the ability to get the person to the hospital?
Yeah.
Would you have such a protocol? Because where I'm from, we were taught to, if we suspect someone is having a stroke or a heart attack, to put cayenne pepper under the tongue to buy some time. What does Ayurveda or Siddha Veda say about this?
Yeah, we can do that if time permits, situation permits, if client permits, if something is possible to do. Normally in that critical moment, most of the time, it's good to like a straight to start the treatment, like a normal Western treatment. School medicine is the right option. At this moment, once the like a situation is settled, then we can come back to our Ayurveda. So by any chance, if not available anything from the school medicine or allopathic medications, then of course, as no option, no choice, we can try with this. We can look for this black pepper and all, but yeah.
So black pepper or cayenne pepper. We usually use, okay, great. That's good to know.
Yeah.
Thank you so much.
Yes, welcome. Yes, Lisa.
Hello, hello. I've been admiring you guys from far away, not being able to go to India at this point. But I will be going to California in May. You're gonna wait your turn. No, you're gonna wait your turn. And so I will be there for about 5 days, joining my daughter on a tour. And I'm wondering if there's anyone I can connect with somewhere near the Disneyland area who I would be able to meet up with and practice pulse or talk Ayurvedic, anything. So I don't know if there's anyone in our group that lives around there. How can I find the answer to that question?
Yeah, I think, yeah, someone from Ayushakti is supposed to travel to US in the month of May. So I don't have exact dates in which date on like which date, which area, but there is, yeah, for sure, someone will be there. But otherwise in California, in that part, many of us are there. And if clients and your practice and you can, yeah, for sure. You can contact.
So would someone email me? Like, how am I gonna find that out?
So from the California part,
Maybe ask in the path WhatsApp
Group.
chat, because there's a guy who is in San Diego who has been doing post clinics and stuff.
Yeah. So there's in the 3-year path, our WhatsApp common group, you can put this question.
Okay, I'll try that approach in San Diego. Okay, great. Thank you.
Exactly. Yes, Yasmin.
Hello, Dr. Hemang. Hi, everyone. Thank you. First of all, I just wanted to say really, really I miss being there in India, but we enjoyed and found the session. The whole training was fantastic. It was very well organized and it was very informative. So thank you very much for allowing us to be able to see that as well. I missed a few sessions, but yeah, it was really good. I have two quick questions. Thank you, Dr. Komal, as well for this brilliant lecture today. The first question is, you mentioned Google, Shuddha Google, and there is, which is Rasnabi Google. So just wanted to understand, are they the same products, same thing, or there's a difference between the two? And the second question is again about grapes that I put in the chat. There are black or purple grapes and there are green grapes. So in terms of quality or effect, are they the same? So just those two questions, please. Thank you.
Both are different, both Googles are. So the Google is a separate, unique product. This Google, when we mix with Rasna, it becomes Rasna Google. When we mix with the Yogaraj Google, it becomes Yogaraj Google. There are the several combination, formulation where we use this Google. So Google is a unique, separate, single herb like Ashwagandha, Satavari, Guduchi, all others.
Okay.
Regarding the grapes, all the grapes have a unique, separate, individual effect.
So the ones that have been mentioned in the lecture, these are black grapes, aren't they? So you're talking about black grapes, black or purple, yeah?
Yeah, raisins.
Okay, raisins, yeah. Okay. Thank you.
Thanks. Yes. Yes, Afsane, you have something to ask?
Sorry, no, my hand is just up. I'm going to lower it.
Perfect. Perfect. No, it's okay. Wonderful. Super. Great. More questions, more understanding. Question from one person and getting understand every one of us. It's a great learning process. We believe, request that everyone. Sorry, Jaina.
No, I just have a question. I just want to know how I can express my gratitude for you guys live streaming the sessions. I stayed up as late as I could watching every one of them, just loving every bit of it and loving watching everybody connect and just really bond, and wishing that I could have seen behind the scenes, and because I've heard some extraordinary sessions, but I just really don't know how I can express my gratitude for that. So thank you. That was my question. If there's any way I can express my gratitude, let me know.
Me too.
Thank you.
Me too.
We're all in the same boat. Thank you.
Because you have.
Me too.
Couple of you are always, even the late night and early morning, so much difference in the time, but still that was like an indication, evidence of your interest. Just because the situation you were not there in person, but otherwise by heart, by mind, you are fully there with us. Nice.
Thank you. It was
Great.
Wonderful. It was just wonderful to watch everything and to connect, except for the leeches. I didn't really like those, but I understand now that how beneficial they can be. But it was really I didn't like those.
Next time, when you will be here, we'll do this leech treatment on you.
Only if she needs it, not if she doesn't.
And yes, next time we expect and we believe that everyone in the Spark group will be there. And we are already, they started working on the plan, like what to cover, what to talk next time. And some, yeah, special plans are also there. Some special that maybe in the next month we will talk and announce something special about next year India program. But good, meanwhile, my request from the all over everyone from the Ayush Shakti, please use this knowledge, apply this information to your families, friends, clients, and have your practice continuous. Like the more you do practice, more swimming, you become more skillful swimmer. Without practice, no, it remains just as information, knowledge. It remains in the book, it remains in the computer as a Word file or Excel file, PDF file. Just every time we download the files and making the folder, the size increasing, it's blocking the computer space, nothing else. But after applying, you can have, and maybe whatever we are answering today, your questions it's from the practice. It's from our clinical experience. What we are seeing, what we are doing, all the answers that we are giving to your questions, it's not written in any book. It's not from any like a sahitas. It's all from the practice. We wish that tomorrow there will be a day when you will answer the questions. That is possible only when you will have great experience, your own understanding that what to do, when to do, why to do, how to do, why not to do this, why to do this. It's possible only when you have lots of practice. Yes.
I would like to say that, even though I wasn't there in person, I think that I learned so much from viewing, but also, of course, the sessions. I mean, because when I talk with people now, I view their complaints differently. So I was talking to a coworker and they said, they were talking about how they were losing their hair and how their acidity had increased. And it's so, oh, you've got a pitta disorder. And, and it's just amazing how my mind is shifting where they're feeling like they have no hope. And I'm looking at them with the possibility of change. So just even, the repetition of listening to the sessions, not necessarily reading the pulse, has made a huge difference in my life. So.
Yes. Yeah, every way it's learning. It's not only just by reading pulse, but any which way, doing practice, using this knowledge, information. And one more news that next month onwards, most of the time, except some months, every month, second Saturday, we will have a special class, special session from Krishna. Every month, second Saturday. So because normally we have our session on first and third Saturday, and second Saturday, he will have from his side the special session, except when he will have an exam university exam, then he will take some break, that 1 or 2 months. Otherwise, he will be here with us from the month of May. Thank you, everyone. Thank you. See you on 29th, next Saturday. This month, we have the little change in our schedule because the India week. In the month of April, this month, we have the class today, 15th April, and now second class, 29th April. Same time, same platform. Thank you. Thank you.
Thank you, everyone. Namaste.
Namaste.
Thank
Thank
you,
you.
and I
Thank you,
love
Dr.
you.
Kamal. Love you,
Love
Dr. Imang.
you.
Love you, Dr. Kamal. Love you,
Thank
Rosanna.
you,
you
Dr.
all.
Kamal,
love you,
Dr. Himal.
Andrea.
Love you,
Love you all.
Sharmini.
Hi, everyone.
Thank you.
Love you, Robin.
Love
Love you,
you.
Kaylee.
Love you,
Okay,
all of you.
Love you.
Germany in UK.
Thank you.
Love you
Thank you,
all.
everyone.
Bye.
Bye.
Thank you.
Thank you all. Bye. Bye.
Thank you, thank you.
Thank you. Thank you.
Thank you, Dr.
Thank you.
Hema. Bye. Yeah.
Bye.
Hi, Pilar. Kiss your mom for me.